Hey guys, tonight I don't want to talk about, my COVID stuff that I've been going through in my recovery. Tonight I'd rather talk about you, and I'd rather talk about your family, and I'd rather talk about your loved ones and friends, and how Kansas City's healthcare is in a huge crisis and how that affects you guys. So, enough about me, and let's talk about you. So, and before I go any further, let me just clarify anything that I've told or shared with you, rather, on Facebook about healthcare or anything I've discussed is stuff that I have gotten from the front line, those working in the field. I've gotten this information directly from doctors, um, physicians' assistants, nurses, respiratory therapists, various types of technicians, various types of healthcare workers. I don't get this off the news. I don't read the news. I rarely watch the news. So this is all basically from the horse's mouth. So let's talk about how right now, today, Kansas City's healthcare system is affecting you and your family and those you know. And right now, Kansas City is in a crisis in the healthcare system. Is very broken. I can tell you for a fact of two incidences at the same hospital where um, a significant amount of the emergency department, including the head management, have quit. And I can also tell you about an incident at the same hospital where a nurse that I know spoke to her today, and 12 of her colleagues also had a mass exodus out of the same department at the hospital, not the emergency department. These people worked in the birthing center or the birthplace and took care of full-term babies, premature babies, and babies that were on life support. And the reason those nurses quit was because they were taking out of their discipline, which is taking care of babies, sick infants, and they were put in a different discipline temporarily to take care of adults. So there was shortages, staffing shortages in various parts of the hospital. So example, the emergency department would have a shortage of staff, and they had to rob Peter to pay Paul. So they would call up to the NICU and get a nurse from there and take them away from their babies that they were taking care of to come down to the emergency room. Now, how this typically works is a nurse will work a 12-hour shift typically, and they may spend part of that shift 3-4 hours in the emergency department till that area calms down, gets under control. Then they go back up to their department. Meanwhile, this nurse who takes care of premature babies and full-term babies, perfectly healthy babies, and the mommies and the daddies, they're being exposed to COVID while they're working in the emergency department. And then they're allowed to go back to their department. So that creates a huge potential for cross-contamination between departments, does it not? Makes sense to me. So these nurses quit because of that, was one of the reasons, and I don't blame them a bit. They were working. This nurse in particular would tell me, I've worked with babies all my life, and they put me in adult care, and I'm giving medications. I don't even know what they are. I have to look them up to see what these medications are. How confident do you or your family, would you send your mother to a hospital where the nurse has to look to see what kind of medications they're giving you or your loved one? That is the crisis that we're experiencing here in Kansas City. And where are these nurses going? Where are the healthcare workers going? They're leaving the big hospitals. They're going to the smaller satellite hospitals in the suburban areas all throughout town. Some of them are taking early retirement. Some are quitting and starting new careers. Some are going to work for private practice in physician buildings. And I don't blame any of them for that. And so, how does this affect you and your family? Like I said, when there's a shortage in a hospital, they have to get help somehow. They can bring in agency nurses. These are nurses, we sometimes call them hired guns. They are just nurses that work for an agency that may come from Kentucky. They could come from Alaska. They could come from Tonganoxie. And they're just temporary contracted work. So they know their job, but they don't know the protocols of the hospital. So you may go to the ER with a broken arm, if you can get in, and you may be seen by a nurse who just moved here from Kentucky and doesn't really got her bearings yet. You may get a student or a fresh graduate nurse who's still wet behind the ears. So you're not going to get probably the health care you think you're going to get these days. So, and you're lucky to get into a hospital, honestly. With the amount of flow of illnesses that we have, including COVID, hospitals are overrun, overstaffed, so they're deferring to other hospitals, and hospitals are shutting down. They can't take ambulance calls. I'm one of those patients that experienced that. I also was one of the patients that experienced either a nurse that was new or she was agency nurse, but I can tell you she didn't know what the hell she was doing. And they released me, and I probably, had I been a normal patient, good chances I probably would be dead. At minimal, lost my leg. So that's how this is affecting you guys. So whether you get COVID or not really doesn't matter. But if you have to go to the emergency room for any reason, or your family members or whatever, they may not be seen for hours. They may not even get a room in the hospital. They may be stuck out in a hallway. They may be exposed to other COVID patients. It's not a good place to be, and that's because the healthcare in Kansas City is just falling apart. So what can you do to help? Well, let's do something. I want you to pretend that you're a nurse. Okay? You're a nurse, whether you're male or female. You went to nursing school. Let's say you graduated with honors. You've always wanted to be and work in trauma, and you wanted to be an emergency department nurse. So you got your dream job. And you've been doing that dream job for 2 or 3 years, and you've got it down. You know how to run a code blue. You know how to assist with intubations. You've got your job down, and you're living the job you wanted to do. And then suddenly, this new contagion called COVID-19 pops up. And you start experiencing these patients, an influx of patients coming in with COVID. And these aren't just sick patients. These are patients that are critical, that need to be on life support. So soon your ICU becomes full. And now you're finding yourself, your workload has gone from 1 to 4 patients to double, triple, quadruple that. And your 12-hour shifts 3 times a week have now gone to 12, 14, 16 hours, up to 10, 12 days in a row without a break. In the hospital, we don't have a designated break time. We don't have a designated dinner, breakfast, or lunch time. If the hospital's busy, we're busy. We don't stop to take a break. So you become exhausted. You are just tired. And this, I'm talking about you as a nurse now. You are fatigued. Your mind, you are just wrecked emotionally, physically, and mentally, because you just put everything you can into that job, and you're trying to save lives, and you're seeing death on a scale that is you can't even imagine. Okay? So let's imagine you've done 10 shifts in a row, and you worked an average of 12 to 13 hours each shift, and you finally get a day off. All you want to do is just go home and go to bed and relax. But you know you got to stop at the store on the way home, right? Because your milk is spoiled. You need some Cheerios. You need some bread. you need some protein, you need some Red Bull. And so you stop at Walmart, and you walk into Walmart. First thing you see is customers inside the store wearing no mask or a mask up to here. They're touching fruit. They're breaking off bananas. They're squeezing bread. They're over there in the toy section looking at toys. You're hearing people cough, people sneeze. You go through the cash register. People are encroaching in your space because they're not social distancing. How, as a nurse, does that make you feel? How would that make you feel? Think about that for just a moment. Because I can tell you, I would feel angry, would probably be my first emotion, because I felt it. I would feel defeated, and I would feel disrespected and resentful. So how would you feel? Busting your ass for a year and a half, trying to save lives, seeing people die, dealing with that, and then going out into the same public and people walking around like nothing's going on. I can't see behind the hospital door, so it doesn't exist until they have to show up to an emergency room. Or their family shows up to the ER with COVID and gets admitted, and they can't see their family. How does that make you feel? So everything that's going on around us here in Kansas City is going on probably nationally. It affects you, it affects me, it affects my family, it affects your family. So we ask that you do 3 simple things, and that's wash your hands, wear a mask, and social distance, and we would love for you to get vaccinated. You anti-vaxxers, I'm not even going there. I'm not going to try and convince you. You know, I saw a doctor today, had my physical. I got injected for a pneumonia vaccine. I don't know what's in it. I don't know what brand it is. I know there's no chip in there. And I know my arm is sore. And I know I am probably protected from pneumonia. I had blood drawn today because I trust my doctor. And I want to be part of the solution and not part of the problem. So to me, if you can't wash your hands and carry around a little sanitizer in your pocket, so when you touch something in a store or whatever, you can clean your hands. And if you can't wear a mask in public and you can't social distance, then you are just simply part of the problem. You are a link to a huge problem that is breaking the healthcare system of the United States of America. That's pretty intense. And it's very easy to be a part of the solution. It's very easy to wash your hands, carry a mask, and social distance. It's not difficult. It's not fucking rocket science. But to be part of the problem is being ignorant. It's being disrespectful. And you are literally creating havoc in this country. So the reason I wanted to say all that is because I want you to be aware how COVID affects your family, whether you see it or not, because at some point in time, you or a family member or a loved one, a neighbor, is going to have to go to the hospital. And this is some of the situations that they're going to come into. So the health care that you expect to get, you're probably not going to get, if you get the health care at all. I've been on both roads, and it's not a good road, either one of them, to be on. So be a part of the solution. Don't be a part of the problem. And the reason I wanted to do this video is for my healthcare buddies that are busting their goddamn asses. For you, your family, me, my family. This is for you guys. So I hope someone out there watch this video can take something away, that you have a responsibility to the people and family and friends and strangers around you by protecting yourself and by protecting those people too. So do the right thing, and let's help our healthcare workers. Let's get through this somehow, but do your part and be a part of the solution. because we don't need